And today about gastritis. Gastritis, the name itself suggests that it is the inflammation of your stomach lining. Coming up towards the most common location of the gastritis is your antral region, which has been manifested by the epigastric pain. Coming up towards the characteristics of the inflammatory process, first of all, there will be thinning of the mucosal protective layer. Next one is basically shallow erosion. The inflammation will be affecting your mucosal layer, which consists of the epithelial layer, lamina propria as well as muscularis mucosa. Next one is basically an inflammation of your epithelial lining. So these were the microscopic features of the gastritis. What actually causes the gastritis is the chronic use of the NSAID drugs or else the alcohol abuse. Basically leads to an inhibition of an enzyme called as a COX. COX, which is also called as a cyclooxygenase. Cyclooxygenase is an enzyme which basically converts the arachidonic acid present in the plasma membrane into prostaglandin. Now, the prostaglandins in a healthy individual is responsible to reduce the levels of the HCl and to increase the levels of the mu so that there will be a balance maintained. But in the case of the gastritis, as a COX enzyme is inhibited, there is no more conversion of arachidonic acid into prostaglandins and there will be reduction in the levels of the prostaglandins. And this reduced levels of the prostaglandins will be leading to a decrease in the mucus secretion from the goblet cells as well as increase of the HCl from the parietal cells. And this ultimately causes the imbalance between acidity and the mucus production in the stomach, resulting into an inflammation. Common causes H. pylori infection. So H. pylori is particularly a bacteria which is responsible to form the specific enzyme called as a urea. Now this urease basically turns the urea in your stomach into ammonia, and the ammonia increases the survival rate of the H. pylori bacteria. As its survival rate increases, it causes the cytotoxicity, and this will ultimately result in an inflammation of your epithelial cells. One more thing H. pylori does is it increases the levels of the gastrin. Gastrin is an hormone which ultimately results in an increase in the HCl production, and this overall leads to an inflammation. And this was the simplest way to learn the gastritis. Thank you.